Hello, my name is Victor Bishop, and I am the Marketing Programs Manager for Audience Engagement for JBJS, the Journal of Bone and Joint Surgery. I am here with Kent Anderson, the publisher of JBJS's special report, It Takes a Team. This publication is available now at sites.jbjs.org/ittakes-a-team/2014. The report explains how multidisciplinary healthcare teams prepared for the 2013 marathon bombings, responded to it, and helped survivors rebuild their lives afterwards. It Takes a Team details how collaborations among physicians, physical therapists, and other clinicians led to improved outcomes, quicker patient recoveries, and fewer complications. And with that being said, I'd like to jump right in and ask you, Kent, a few questions. Can you speak a bit about the origin of the idea for this special report?
Sure, Victor. Happy to. We've been working with JOSPT for a couple of years on collaborative projects and finding that the professional audience was responding to the natural link between orthopedic surgery and physical therapy, so treatment and recovery. And after the marathon bombing, because we're local, we thought it provided us a unique opportunity to explore the professional connections in the community that was directly involved in coping with what the aftermath of that terrible event. And we had a unique partnership we could bring to it. So with that in mind, we together embarked on producing this special report.
What would you consider being the overarching theme that you hoped would be communicated in this special report?
Right. The main thing we've been focusing on in our collaboration is patient outcomes, successful outcomes, and that the professionals providing care should work as a team and do work as a team naturally. And we want to emphasize this because it's not always the case. And you need to learn how to work as part of a team. You have to learn your roles, you have to honor your responsibilities, and you have to respect the other partners in the team. And so we wanted to show great examples of that. There are great examples of that in the stories in the special report. Also, there's a lot about resiliency, about people coping with things they didn't expect to, and how they came up spontaneously with ways to deal with these things together, and what they learned had learned before going into this event from other crises that they'd had to deal with, whether it was the run-of-the-mill car accidents or other traumas to large-scale catastrophes, and how they had prepared their systems and their teams already for that, and we wanted to reveal that, and then what they were going to do next.
Great. As the publisher, what do you see as the key takeaways of this report for orthopedic surgeons?
Well, I think what this shows and what everybody in Boston has seen is the incredible level of care that can be provided to these patients who suffered horrific injuries, some subtle injuries, a lot of soft tissue injuries, and things that may not have seemed severe are still difficult to recover from, and how orthopedic surgeons working as part of a team were able to really get some incredible outcomes for these people, and how everybody has struggled through together, taking care of each other, and everybody's bouncing back, and we're now on the verge of preparing for another marathon, and people are excited to have a marathon after this.
Can you speak to the response to the report or any feedback you may have?
Sure. We have gotten a lot of positive feedback from this. We have a number of professional societies and organizations in the Boston area pointing to it, talking about it. Emergency physicians have been interested in the content because they have a role as providers in these kind of mass casualty incidents. We have, from Best Doctors to various orthopedic publications have covered it as well. And we're getting good response from the PT community. I think they're very appreciative of the fact that we, JBJS and JOSPT, are working so well together, And they see that in the number of things that we've done together, the previous special report, webinars that we've done together, and other things. And so I think, again, trying to knit the communities together for the benefit of patients is really what this is all about, and I think people are seeing that.
Thank you. Thank you, Kent. Once again, this publication is available now at sites.jbjs.org/ittakes-a-team/2014. It is impossible to name everyone who contributed to this publication within the scope of this short interview, so I'd like to direct everyone to page 3 of the publication to see a list of acknowledgments. Thank you.
Thank you, Victor.